So I want to introduce to all our viewers that I'm doing live with Dr. Shivaranjini. Madam is my mentor. I have been working with Madam since my PG days. Dr. Shivaranjini runs Magna Health Center in Hyderabad, and she's a social activist. I'm a fan of her work. She has done a lot of work in fighting the ORS brand, which we are going to discuss after some time. And also, she has done a lot of first aid training workshops, which have enabled parents to give first aid to the children in many conditions like cough, cold, fever, sometimes choking. All those first aid madam has done around maybe 500 or 600 workshops you might have done, no, madam?
Many number of workshops I don't remember, but I would have trained more than 13 to 14,000 people.
Thank you, madam. So we are coming to the topic of discussion today, madam, that we are going to enable our parents today regarding how to be prepared or how to make our kids well prepared for the coming monsoon. So first topic of discussion today will be fever, madam. So every parent has this fear that if their kid gets fever, uh, they start giving paracetamol. And usually they don't know what the dose is. Sometimes when they come to the OP, they say that we have given some paracetamol there so that there will be the fever will come down. So what temperature should we give fever paracetamol, and how long should we give it, and how long before going to the doctor should we give it, madam?
Okay, see, firstly, parents need to understand, as you know, that fever itself is not a big problem. It's just a manifestation of the disease process, a rise in body temperature. Only when the fever starts rising rapidly, or if it is very high, then it can underarm temperature. So the safest way to measure temperature would be definitely not oral thermometer till 6 years of age.
Yes.
Even though mercury is accurate, we'd prefer digital thermometer because mercury breakage and spillage can cause problems. Ear thermometer should not be used below 6 months of age.
Yes.
So either forehead or underarm, if it's infants. Later on, they can use even ear thermometer if they want to. So any temperature underarm or forehead above 99 or ear thermometer above 100, we'll take it as a fever which may need paracetamol. If the child is still active and is not in the febrile seizure age group, they can still wait.
Okay.
Okay, so but between 6 months to 6 years of age, there is a risk of seizures. Seizures means fits, as you all know. So there is a risk. So that way, like maybe you should start giving paracetamol at that stage. Unfortunately, in India, what happens is parents are very, very, like, you know, they want to bring the temperature to 98, 98.4. You know, they keep checking 98.5, 98.6. It's not needed. Okay, so this is one thing, when to give paracetamol. And in India, we have so many compositions, 1 ml, 100 mg, 5 ml, 500 mg, 5 ml, 120 mg, 5 ml, 240 mg. So just imagine if it is 5 ml containing 500 mg paracetamol. The child needs 120 mg and the mother gives 5 ml. That means she's 4 times overdosing the child. So best thing is on all the labels, the volume is mentioned. For a 10 kg child, you give this many ml, like that. So I think, yes, very clearly it is mentioned. So parents can just go by that. They don't have to even check with their doctor. If they know their child's age, they can just give that. They should not be in a rush to just give off the medicine. That's where most accidents and overdosing happens. Just check the label, check the expiry date, and give the correct dosage only when needed. Minimum 4 hours gap between 2 doses, maximum 5 doses in 24 hours. And very importantly, in India, what's happening is, though we know that mefenamic acid is very toxic and too many doses can predispose to seizures, somehow it has gained popularity in India. So actually, if you see in other countries, If temperature is not controlled with paracetamol, ibuprofen they give, but that also very judiciously. That is available as ibugesic in India. So mefenamic acid is available as Meftal. And now what's happening is combination drugs are there. Ibuprofen with paracetamol, mefenamic acid with paracetamol, like ibugesic plus meftagesic. So I would request parents to avoid these, because when you give combination drugs, no, then when you want to give either of the drug, like say in ibugesic plus ibuprofen and paracetamol. So I want to give an extra dose of paracetamol or ibuprofen. Again, I'm confused how much gap I have to maintain between these doses.
Yes.
So avoid combination drugs as much as possible. And one odd dose of mefenamic acid, if ibuprofen is not available, is fair enough. If ibuprofen is not available, but do not overload the children with all these medicines. Okay, they are not good for the tummy. They can cause increase in acidity, gastritis of the tummy. They can affect the kidneys negatively, and too much usage can actually predispose the child to seizures. So only when the temperature is uncontrolled with paracetamol, one dose judiciously, not on empty stomach, and the correct dosage. If ibuprofen is available, prefer it. Otherwise, only mefenamic acid, but very, very judiciously. And if you are needing these medicines often, that means it is time to consult the doctor. That means your child's fever is so uncontrolled. That means there's some problem, underlying problem, which needs to be addressed. So better consult the doctor. Or if fever goes beyond 5 days, or if it is 102, 103, 104 all the time. The other thing parents do is sponging with cold water. That should not be done. They have to sponge the child only with lukewarm water in the center of the body. The funda behind that is basically when we have fever, the core body is hot. If I keep sponging the peripheries and all with cold water, the temperature shifts to the center of the body, and actually brain, heart, all the vital organs are here. In fact, seizures can be precipitated. So never sponge with cold water. Sponge with lukewarm water, and that to center of the body. Like forehead, groins. Yes, forehead, front of chest, back of chest, underarms, groins, neck.
Okay. So I want to conclude again, madam. For this is Prosin drops. So there is dosage here. So if there is a parent, they want to give a dose, I think they should check here. And in the middle, it is 5.5 to 8 kg. It is 0.8 to 1.2 ml. So as you said, they should give every 4 hours. But if the temperature underarm, if it is 1 to 6 years, crossing more than 99.5 and is increasing consecutively, that means the temperature is increasing, then we should give paracetamol. Same with kids who are elderly. You go with the syrup, check the dosage on the syrup and give it accordingly. And if the fever is uncontrollable, once you can give ibugesic, that too with not with empty stomach. They should have something and take ibugesic. If ibugesic is not available and fever is uncontrollable, we'll give Meftal, but once in a while. That too, you should avoid it all the time.
Not on empty stomach.
Not on empty stomach. So that is regarding fever. One more doubt, madam.
My patient. So one more thing, they should not give mefenamic acid or ibuprofen below 6 months.
Below 6 months. Not given. One more doubt, madam. When parents come to me, they want the temperature of the child to go below 98. They don't want fever in their child. And I tell them that some amount of fever is good, so that the child will improve better. What is your take on the average temperature of the child?
Exactly. Like, see, basically when the average temperature, the normal body temperature is 98.4 degrees Fahrenheit or 36.9 degrees centigrade. As I said before, we don't have to push it below that. As long as the child is active and the fever is not affecting him at all and he's not in the seizure risk age group, I don't think, not only I mean, the consensus is that we should not aggressively try to control the temperature. It's not my own thing. It's all academies of pediatricians. That's what they say.
And one more thing is, even if the temperature is 100 or 99.5, parents go on to sponsor their child continuously, and they want their child to be very cool.
Absolutely not needed. Absolutely. Only 102, 103, 104. Then we sponge with lukewarm water, and that too judiciously the center of the body, and that too only if child is cooperating. If child is saying I don't want, you cannot do it.
So finally, we can conclude about fever that if the fever is uncontrollable, we have to visit the doctor and check the dosage. And high temperatures, we have to sponge and then try ibuprofen most commonly. That too very judiciously. Okay, madam.